Have you ever been doomed in Zoom?
Hey, Mrs. Smith, so good to see you. I hope you're doing okay after surgery. How are you Mrs. Smith, do you have your speakers turned on your computer? Your volume? Is your volume up? Can you hear me? You can't hear me. Okay, well, hold on. All right, Mrs. Smith, geez, how you doing today?
I'm great. How are you doing?
Do you have your video on?
No, I can hear you, but I can't see you.
Mrs. Smith, do you have a camera on your computer? Do you know?
Well, I have cameras on my computer. I don't know.
Okay, Mrs. Smith, we'll hang up and I'll call you back. So, Mrs. Smith, how are we doing today?
I'm doing great. Although my lip after the injection, what do you think about the way this looks?
Mrs. Smith, I can't even see you. I believe you're standing in front of the window with the camera pointing to the window, and it's washing out. So we'll have to just change your computer.
Change my computer.
Okay, Mrs. Smith. So how are the lips doing today?
They're okay.
Miss Smith, stop. You're supposed. So, Mrs. Smith, how's the incision line in front of your ear? Let's take a look at it. Okay.
Well, it's fine. It's
Okay.
well here. Hold on.
Mrs. Smith, I'm getting vertigo, and now you have a poor internet connection, Mrs. Smith. I think we need to start over.
Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and it's good to be back. So I was off, like many of you, for almost 6 weeks, and I thought I was going to get all this stuff done, and I didn't get hardly any of it done. I am working on the 3rd edition of my textbook, so I wrote hours every day, and I'm still doing that. But it was amazing because it was a little prequel to retirement, and it made me realize that I am in no way ready to quit doing what I do. I really I missed my patients, my surgery, my staff, my office. So one of the things that's going to come out of this whole COVID situation, we're going to change the way we do things in a lot of respects. I have a lot of different friends who had to start working from home, and their employers have said, hey, this works out pretty good, stay home. And I saw the other day where I think it was Twitter, they told all of their employees, don't come back. We're going to work totally from home. So you're going to see a lot of paradigm shifts, and certainly we're going to do a lot more telemedicine and video consultation. So I want to talk about that for a little bit. Like many of the people watching, I have an international practice, so I've been doing Skype, Zoom, FaceTime consultations for years, and but nowhere near the volume I'm doing now. So just 6 or 8 weeks ago, there are many people that never heard of Zoom, patients, doctors, and it's become one of the most favored platforms. So Google and Skype and IBM, all these companies are coming up with their own video platform. So let's talk a little bit about this. I'm doing a ton of these, and since we're still in the midst of this virus, I'm not charging for any consultations. When this is all said and done and it's over, I will be making this a part of my practice. I will schedule a part of my day where I'll be doing online consultations, and I will have some consultation fee. So I'll carry that over at a certain point in time and do that with my online consultation. What I really want to talk about today is the mechanics of this. Because when we came back to work, my staff assumed that I was going to sit at my desk at my computer, and we were going to do our Zoom consults for your regular consultation for patient that I've never seen before, or our follow-ups. And we're trying to limit people in and out of the office. So where I would normally do 1 and 2 week follow-ups, most of the stuff I can do over Zoom. So again, my staff thought I were going to sit down, and I was going to send a little Zoom link, and the patient was going to get on, and I was going to look at them, and everything was going to be fine. Well, it was a nightmare because, as you know, if you've done much of this, patients sometimes aren't the most computer savvy. So you got to say, okay, turn on your mic. Okay, no, that's the wrong camera. Turn on your camera. And you spend 15 minutes trying to get up and running. So what we have done is made a step-by-step guide, and I'm going to make a video on that as well. And we give this to the patients beforehand so they can download the application, they can make sure their camera works, they can make sure that their audio works as well. The other problem is, you call somebody and then they're not there. So we're kind of doing the what I call the Comcast deal. They'll say, well, we'll be at your house on the 14th, sometime between 8 in the morning and 5 at night. We're not that bad, but we do kind of put a 15-minute, half-hour window in there. Okay, so we want to make the rules, and that's working better. I'm trying to do this twice a day. The first couple days back, we were just doing it random, in between patients and everything. And again, you waste so much time getting the patient on there, getting set up, that it was just too much of a distraction. So we're doing them in the morning, doing them at the end of the day. That's worked out much better. And we're scheduling them. And I'm not much, I'm a great, I drive my staff crazy because I'm so good at, just tell them to come in or just bring it on. But you can't do that with this. I think you really do need to schedule it. Now, for some patients, your out-of-town patients and everything, obviously that works, and we are trying to limit people coming in and out of the office, but sometimes patients that could easily come in will try to push it off. And I don't mind, my staff can do some of these follow-ups. My nurses can tell if a patient has a hematoma or if their suture line is healing correctly. But one of the other problems that I've encountered, and I'm sure you have as well, poor internet service. Okay, so it's very, very choppy video, and I'm on a high-end computer and camera on my end, and the patient's on their phone, and they have bad bandwidth, or they have a really inexpensive computer camera that's poor resolution. So sometimes a video consult, you're talking to them, but you really can't see that well. So in our list, it's important. I tell them, sit in front of a window facing you, so you have good light coming in. And don't sit in front of a window with your camera facing the window, because we see that a lot too. So you want the proper positioning, the proper lighting, you want the sound to work, you want the video to work. So the other part of this puzzle, again, I said we were doing this all at my computer, at my desk, and it was an interruption and I had to wait. So instead of doing it on one computer, we've gone to using our tablets, and my staff will get the patient on there, make sure their video and audio is set up, make sure their lighting is correct, and then they'll bring the tablet to me. So that portability is very good. Even though I have higher end equipment, I think the portable tablet situation is superior because I don't have to have people in my office using my computer trying to hook up. Hope that. And I think, they say that necessity is the mother of invention. And I think that many good things are going to come out of this. And I think that video consultation, although for some of us we've done it for years, it's really going to ramp up, and it's going to be a big part of every specialty and everything we do. So that's kind of been my experience with it. I want everybody out there, keep your chin up. This stuff's going to pass. We got to figure it out. It's great to be back at work, and thank you so much for your time. I'm Dr. Joe Niamtu. Love that face.